Hi, my name is Kelly Losi, and I'm the Communications Coordinator for the Benton County Health Department. Beginning today, Benton County is at the extreme risk level under the Risk and Protection Framework. We were placed in this new risk category based on the rate of cases in our community and the percent of COVID-19 tests that were positive. Both of these were measured from our data over the past 2 weeks. This new risk level will be in effect until December 31st, 2020. Under this risk level, there are additional guidelines in place regarding gatherings, restaurants and bars, retail stores, recreation and fitness establishments, and other locations. You can find the full list of these new guidelines on our COVID-19 website. The Centers for Disease Control and Prevention have updated their quarantine guidance. They now suggest an option to quarantine for 7 days if you have no symptoms and get a negative test result. A few things to consider if you think this might be an option for you. There is a higher chance of spreading COVID-19 to people if you end your quarantine after 7 days. There is also a high demand for local testing and limited resources, and it may be difficult to get negative test results in a timely manner. You may quarantine for a minimum of 10 days if you have no symptoms, but 14 days is best. Remember, a shorter quarantine isn't for everyone. You should stick to a 14-day quarantine if someone in your house has COVID-19 or if you live or work with people who are at risk for serious illness from COVID-19. A 14-day quarantine is the safest way to prevent the spread of COVID-19 to others. Beginning Monday, December 21st, our COVID-19 phone bank will be reducing the number of days that we are staffed to Mondays and Wednesdays from 1 to 5 p.m. If you call when the phone bank is not open, you can leave a voicemail for a return call. You can also call 211 with questions about COVID-19, and they are able to take calls in both English and Spanish. As you may have heard, the first doses of the COVID-19 vaccine were administered in Oregon on Wednesday to healthcare workers. While the news of a COVID-19 vaccine is encouraging, we are still a long way from COVID-19 being over. The initial vaccine supplies are very limited. The Centers for Disease Control and Prevention and the Oregon Health Authority plan to distribute the vaccine first to healthcare workers and residents and staff of long-term care facilities. Essential workers and people with high-risk medical conditions will be offered the vaccine in the following phases of distribution. At this time, the vaccine will likely not be available to the general public until late spring or early summer 2021. You can find out more information on COVID-19 vaccines in Oregon by visiting Oregon Health Authority's website below. I know that new restrictions under our risk level are stressful for those in Benton County. At this time, we need to do everything we can to reduce the spread of COVID-19 in our community. Please continue to take care of yourself. Stay safe and be well.